My name is Yunshi Wilson, and I'm the guest correspondent for MedEdge, MEA, here at the Critical Care Congress in Abu Dhabi. I have with me here today Dr. Jaques, who is a Senior Corporate Medical Director for MediClinic. Thank you for being here with me today.
Thank you so much for having me.
Wonderful. So you just left the stage talking about organ donation. Walk us through that. Why is that such a critical thing, and what should people know about it?
So I think one of the most crucial parts of a Congress like this and in the organ donation panel, which I was part of, is because it shows you where the gaps in the healthcare system might be. Okay, and how we can fill those gaps. And I think one lesson that's come out of this, which has been an excellent discussion with different collaborators throughout the UAEs, is that awareness of organ donation and the potential to help patients and their families live and survive is not to the level it should be to make the program as successful as it could be.
Okay, so what are some things you would want people to know if this was your moment to kind of create that awareness? What would you want people to know about it?
So I think for patients in residence and citizens in the UAE to understand that not only was organ donation a very altruistic and compassionate thing that they could potentially do, but it's also been not only vetted but endorsed by our very supportive and innovative leadership, supported by our religious experts, and is the opportunity for an individual to really give back to their community and potentially help other patients and families. So when I mean about awareness, I think not just in terms of the regular citizens and population, which could be aided by public service announcements, ministry advocates, social media, those sort of campaigns, but even in the healthcare community. You would be surprised throughout the healthcare organizations in the UAE what level of awareness clinical practitioners have about the organ transplant program in the UAE and how they can potentially assist it.
Wonderful. So how old does someone need to be to donate?
So the age limit usually we have for adults,
Yes.
right? Although there are some opportunities for pediatric transplantation. Of course, there's different rules and regulations around each age group because we want to make sure that this sort of a program, which is for the benefit of all, is also very ethical, very high quality with good outcomes. So there's definitely standards that the government have put into place to make sure that organ transplant harvesting and donation are appropriate, ethical, and high quality.
So what are some myths you'd like to immediately dispel about organ donation? For someone, they hear that and they're like, what's something you'd love to dispel?
So initially, I think before the initiatives from the UAE government and other healthcare organizations started to dispel some of the concerns around maybe religious issues, I think the biggest thing that we need to break down now is, volunteering to be part of an organ donor registry or signing up from it is not a commitment. It's simply an opportunity.
Okay.
And it doesn't mean that if you do sign up, you're going to be called upon. And God forbid something should happen.
Right.
But it is widening the pool of potential help and treatment for patients who need it.
Are there any particular organs that are more a necessity than others at this moment in time?
So kidney transplants are always high in need.
Okay.
But of course, as patients develop other issues, there are opportunities for liver transplants, sometimes even heart and lung, corneal transplants. But kidney is definitely high up.
Okay. Wonderful. Is there anything else that you'd love for the audience to know?
I think just the idea that organ transplant is one of the most compassionate and altruistic an individual can choose to do. Just signing up, being aware, making sure that your family is aware of your own individual wishes. It's easy to do. It's incredibly important. And that is the way we're going to end up helping the people who need it in the UAE and in the region.
That's wonderful. Well, Dr. Jaques, thank you so much for being here with us today. I really appreciate it.
Thank you so much. You're happy to be here.